I would like to turn it over to Swetha Totapally to introduce her panel and co-panelists. Swetha is Associate Partner at Dalberg Advisors and a longtime Indiaspora supporter and member. Swetha, welcome, and over to you.
Thanks, Ashif, and thanks to the Indiaspora community for having me. The Suffer video is really heartbreaking, and as it highlights, it really took the pandemic to bring to the forefront the grim reality of India's nearly 200 million migrant workers. For so long, they've been marginalized and undervalued, and it forced so many millions of them to leave the lives they'd built in the city and migrate to their villages and homes, and 75% of them lost their jobs in the process. There's a lot of organizations across the nonprofit space, private sector, and public sector who really just, and this is extraordinary, who just took such swift action and provided immediate relief to the migrant workers at the peak of the crisis, the initial days as the lockdown was announced. And these efforts were incredibly critical. They're also the start of what I see as a much longer journey towards resilience for migrant workers. And I think we need to start thinking about how to shift our focus and efforts from short-term relief to really thinking about how do we ensure a life of secure employment and access to resources, such that migrant workers are able to come out of this pandemic better off actually than they ever were before. Because the current status quo, even at the beginning of the pandemic, but even before, was not sustainable. And I'm really honored to be here today with the folks who've worked tirelessly to support migrant workers through the crisis and beyond. Ashif, the founder of Sahas, Naghma, the president and CEO of EdelGive Foundation, Anshu, the founder of Goonj, and Govind, who's a philanthropist and a board member of GiveIndia. We'll spend some time talking about the current state of India's migrant workers, as well as what needs to be done to build a more resilient future. Anshu and Govind, I wanted to start with you. Goonj, Sahas, GiveIndia, all of you responded to the pandemic as soon as the lockdown was announced, and you were able to reach the most remote parts of the country at scale. The speed of the response I found to just be truly extraordinary. What did you do, and how were you able to respond to the needs of migrant workers so quickly?
Anshu, you want to go first?
Fine. Thank you. Thank you, Indiaspora and all, for organizing this. And before I start, I need to make a correction, that the 3.1 million NGOs figure, which we spoke about in the last session, to be honest, has no evidence, but because we do not have any data, that is why that particular figure is going around all across. Fine. So I think that needs to be corrected, because the people who are trying to work on the data of NGOs, they haven't got any proof of that. That's extremely important to set the context. And, a couple of very important points, Swetha, is that these migrants were not visible. That's it. So otherwise they were there. It's just that we never took care of them, and suddenly they became visible, and we started worrying about them. And I'm certainly worried right now that we don't remember that they exist wherever. So that's another round of reality which we need to understand, and we need to focus on that. Why and how we were able to do a little bit in this entire response part, because in the last 2 decades what Goonj has been able to do is literally laying like pipelines of relationships, of logistics, that I always compare it with the optical fibers. The telecom companies did that, and now they're actually using it for multiple purposes. So the last 2 decades, we laid those pipelines between the villages and the cities of India. Pipelines which can talk about logistics, which can work on logistics, which understand the need of people, which understand that if you are giving, say pulses or dal in northern India, chana dal is okay, but if you go to South India, you need to really think about the tur dal, right? I mean, how do you really match the needs of people? Because one of the biggest problem with donation is that you give what you have. You do not give what people need. And a country like India, which has always enjoyed its diversity, where if you go to southern India and you find these 5 states touching border with each other, but each state is eating different kind of rice, fine. So we enjoy that diversity, but when you have to work on the development, you have to be very localized, and you have to focus on that. The learning which we had of the last 2 decades of building this institution and working, with the grassroots, I think that became very handy. because the systems were set, the logistics were there. Of course, it was a completely different challenge because an institution which works in open, which hub and spoke model. So now the transport is not there. Now, whole lot of things which we set up were not there. But I think because the team was there, because the knowledge was there, because those pipelines were there, we just had to change the model. So, I mean, just in a line, in the last few months, we have done more than 3.5 million kgs of just the dry ration, which otherwise we don't, work on that scale, or more than 180,000 of kgs of local vegetable purchase from the last, farmer. So that's how we are able to scale it up, because and in many institutions, to be honest, because they are very near to the realities of the country, and they recognize that migrants were there earlier also. Now we have started calling them migrants. So I mean, those organizations were really able to respond much faster. I'll stop here. Over to Govind.
Thanks, Anshu. And Swetha, thank you and Indiaspora for providing GiveIndia this opportunity to share our learnings. Just a brief comment on GiveIndia for those who may not know it. It's India's most trusted online donation platform. So we aren't an NGO that's implementing like Sahas or Goonj, but we've been around for 20 years, and what we do is help NGOs across India. And once you donate, it connects the donor with the donee. And that's really been the success of GiveIndia over the last 20 years. In response to your question specifically, Swetha, I think given our past experiences with previous disasters, we realized sometime in early March that this could be a much bigger situation that we've ever seen. And like Amit had mentioned earlier, we had to do something to sort of repurpose or refocus ourselves. And so we launched for the first time ever a sort of COVID mission fund around March 20th. And that's before the lockdown even was implemented. And we realized that the communities that will be affected the most will be the migrant workers, especially with the lockdown. And this became our biggest focus in the very first week. Very quickly, we expanded our focus, and this was based on a lot of feedback from nonprofits, that the need was to solve hunger issues and to do that through meals and ration kits, exactly what Anshu just referred to. And that was the next focus we did. We moved from livelihoods to basically food. Given our deep partnerships with nonprofits across the country and the pulse on the ground constantly, we saw a big support coming in on our way to this mission. And this led us to conceive the India COVID Response Fund, which we called it, which was created by many senior leaders of the corporate world that came together. And collectively, this fund raised over $30 million in about 2 months. And this was possible because of the significant support from the Indian diaspora around the world, and with about 90 corporates and foundations supporting this effort. One of the other things that came through on this was a phenomenal retail funding. And we'd never seen 250,000 people contribute as individual donors in such a short span of time before. And that was really, really heartening to see in India. I think which was talked about earlier, where Rati mentioned it as well as Amit, that this is a change that's happening in India in terms of philanthropy. The focus of our efforts was on livelihood support, health, and humanitarian. And we worked through about 200 NGOs across India to reach about 5 million people over a 3-month period. And while initially we addressed largely the food and health issues, by end May we started talking about supporting them to return back home, because they realized that they don't want to stay in the cities anymore. In summary, I must say that our success of response has largely been because of the speed at which the NGOs really mobilized themselves to make the relief efforts happen, despite the lockdown. I think Amit mentioned it. I think Anshu also mentioned it. It was a real challenge in getting things done, and I'm really proud of the fact the way the not-for-profits really worked on the ground. So with that, let me hand it back to you, Swetha, but this was our response to the situation.
Thanks so much, Govind, and thanks, Anshu. I think in addition to mobilizing really quickly and raising a lot of funds, one of the things that happened so importantly and early on was actually that people like Ashif at Sahas really helped bring the plight of migrant workers to the forefront of national consciousness. I remember the initial Sahas report on migrant workers, and it just was completely eye-opening for the country. It was everywhere. And Ashif has been everywhere for the last 7-8 months as well. And so Ashif, I wanted to ask you, what does the situation actually look like for migrant workers on the ground now, 6 months after the beginning of the lockdown? And in your view, has that initial outpouring of support that we saw in those early days in late March and early April, has that continued, or do you think it's really just dried up?
Yeah. So, I will start with our research that we completed within a 2 week of first lockdown. So we released our report in April, and basically during the survey, I was also participated, and we collect the information through the telephonic interview. And most of the people discuss about the migrant issue, we discuss about the food, we discuss about the employment, we discuss about the financial security. But the migrant worker raised again and again one issue about the dignity. During the lockdown, before the lockdown, like the discrimination and exclusion is a very big problem with this community. And as Rati mentioned, the government says about 140 million migrant worker in India, but according to our estimate, between 200 to 240 million migrant worker. So it's a huge population actually. And these people migrating from the rural area because of the discrimination and non-availability of employment. They are going to the urban area. They build our cities, they build our hospital, all infrastructure. And in city, they are facing lots of like the problem, particularly like the discrimination. And basically the lockdown or like the COVID exposed the reality of the migrant worker, what kind of situation they are facing into their day-to-day life. So basically in our report, we try to capture all these issues and the human stories. And as of now, about 600 newspapers publish the finding of that, study. That's very important. But at the same time, like we try to continue this discussion in the migrant community also. It's a not issue of larger like the communities, because in the previous the parliament session, many parliament members raised the issues about the migrant. So some people raise issues about the death of the migrant worker, but no any data is available in India in any government department about the deaths. But if you see the not-for-profit or like some research organization collected lots of data. So that's one thing about the data. The another thing, basically in Sahas, we decided like these migrant workers required immediate support. So as of now, we provided like various kind of support to 1.5 million migrant workers across 102 districts of India, and we covered about 19 states with support of local 40 civil society organization and the community organization. And basically some of our donor and supporter also in this like the call. So basically supporters provide various kind of support. So that's why we are able to like outreach and basically serve to the migrant worker. We provided basically mental health support because we documented more than 500 deaths of the migrant worker. And out of these 500 deaths, about 28% deaths because of the suicide. So the distress level of the in the migrant community is very, very high. We also provide like the transportation support because people basically walking from Delhi to Bundelkhand or Bombay to like Bihar, and they required lots of support for transportation, food ration and some other things. In my team, about like 400 people basically not went to their like homes for at least 100 days. So they like stay outside, and more than 60 people basically COVID positive, including me. So that another kind of like the issues. But basically we realized community required like comprehensive support, because many times in the civil society, we, as Anshu mentioned, we identify need of the community and we basically try to make, like serve. But community requirement is very different. And the one another point about the portability. In India, we have various social security schemes, but only for the local people, not for the migrant worker. So if I am a migrant worker from the rural India and I'm traveling to Bombay or Delhi, I'm not eligible to get any social security benefit, including ration, including pension, including like food, supplementary food for my child. So these kind of issues are there, and no any political party is like very sensitive about this issue, because these people are eligible to vote in their source areas. So these kind of issues migrant worker facing. And the last point I wanted to raise here, In this situation, we realize we need a long-term response for the migrant community. And basically, we use this opportunity because nowadays a large number of like the organization policymakers are aware about the like the pain of the migrants. So we initiated a migrant resilience collaborative. It's a world's largest migrant support program. Under this program, we will cover about 10 million migrant worker family in the next 3-year period of time. Tomorrow we will start 72 district level migrant resource center across 11 states. And we are also launching a migrant helpline. So basically they can get immediate support, any kind of support on a real-time basis. So yeah, so now I can stop. But the last thing I wanted to hear, I wanted to tell you, it's a very, very important this issue we can like highlight at each and every platform. And it's not only responsibility of the civil society organization, but we need a collaborative response. So basically response from the civil society, from the private sector, and most importantly from the larger society, because it's a clear-cut failure of our society and we are not save our people in this difficult time. Thank you.
Thanks, Ashif. I thought the point that you made around, that the crisis is continuing for migrant workers and didn't end with those first couple of months of relief, I think is a really important one, and really starting to think about the long-term future for migrant workers. And Anshu, I wanted to actually hand it back to you. Ashif is alluded to the fact that we actually haven't learned necessarily from our prior mistakes. In your view, what is it going to take for us to go about supporting building a more resilient future for migrant workers? Said differently, if you had $1 to build migrant workers' resilience today, where would you put it? Would you put it in terms of improving the safety net in cities, or actually strengthening the opportunities in villages, and why? Anshu, you're on mute.
I'm saying that if you really want to hear the actual part in my life, I hate the word resilience now, because I believe in India we are too resilient, right? We're too resilient, and we have taken that as part of our life. Otherwise this kind of disaster wouldn't have happened. I mean, we would have been much more sensitive about the people around us. I mean, these millions of people were forced to walk. I mean, and then the important part for us is that they came to the cities as a part of the forced migration, right? I migrated from Dehradun by choice, but almost all of them migrated, because of compulsion, and they went back in compulsion, and now they're coming back in compulsion. So their entire life just goes in compulsion. Right? So I do not want to make any kind of resilient future for those guys. It's extremely, I'm very upfront that this is the high time that society really understands that if all of us can enjoy this, seminar and now called webinar, on our laptops with a cup of coffee, we must understand that every single house where we are staying are made by those people who are now homeless. And every single thing which we are eating is actually grown by the people who are now in the queues, and very proudly we call them beneficiaries. So I think those notions need to really change. Before working for other people, it's extremely important that we work on ourselves. We change our thought process. A lot of crises couldn't give us that chance, but an invisible virus has given us that chance to make a dent on our thought process first. We start calling ourselves beneficiaries, because by providing 10 kg rice to someone, we are calling that person a beneficiary, and someone is giving us rice till the age of 40, 50, 60, and we are still calling them beneficiaries. So how do we really change our mindset before we try to build something else? I mean, because how do we make sure that now at least we put in more efforts in the villages of India so that people do not migrate by force or by compulsion? But migration by choice is always good. So let them migrate if they migrate by choice. How do we change the definition of skilled and unskilled? I mean, how can we call a farmer unskilled who can grow 200 different varieties of rice, and call ourselves skilled where half the innovation happens on papers only? So how do we bring a farmer to to the city, make them a plumber, and then start calling them a skilled. So these definitions, these parameters of people like us who wear good clothes and study in good universities, those need to change. Then only we'll be able to make a better society where there is a trust. Because what happened here in India, for sure, is just my last point for this to respond to you, uh, is complete deficit of trust. Those millions of people didn't trust any one of us. The biggest corporate guys, the biggest NGO guys, the biggest governments, the biggest corporators, no one at all. So if we really want to build a resilient society, if we really love this word resilience, I think I think the most important part is that we build a society where we have dignity for everyone, where we trust each other, and where we come out of this mode of thinking that I want to live and I want other people to survive. No, everyone has to live and live with dignity. I'll stop here. Thank you.
Thanks, Anshu. And I really loved your point about us being beneficiaries, especially with migrant workers. I mean, they power our lives, right? And your earlier point about their being invisible to us until the crisis was such a good one. And this notion of, us really needing to work together to actually build trust and really change our mindset, as opposed to assuming that it's the migrant workers' mindsets that need to change, I think is also really critical. And with that, I actually wanted to hand it over to Naghma. Naghma, EdelGive actually joined hands with Sahas to establish the Migrant Resilience Collaborative along with other stakeholders. And I think there's something really powerful about the idea of collaboratives. It's also mentioned and so I wanted to ask you, why is it so critical that we have a collaborative for this issue? Wouldn't it just be a lot of money through one or two organizations like Sahas or Goonj? What's the importance of bringing so many different stakeholders together in this time?
Thank you so much. It's a pleasure being here and really an honor to really even hear Anshu and Ashif speak, because I'd like to make this point first, that in the social sector has been having collaborations for many, many years now. The model that Goonj runs on, what Sahas has done before and after COVID as well, is an exemplary example of how multiple organizations come together and attack and really pursue a problem together. It is now our opportunity, being as other facilitators in the universe of development sector, to join hands and enable those collaboratives to become much larger, much more robust, and be visible everywhere. EdelGive manages or is participating in almost 6 collaboratives. And there are some outstanding learnings that we've had through just being a part of these experiences. A collaborative is not about joining hands with money. Let's make this very clear. Collaboratives don't succeed. These are not pooled fund initiatives. These are when people join hands and say we are coming together as a collaborative, it means you are co-sharing a problem. You are co-sharing a purpose. And we are all coming in this with the core competencies that we have. Funders may come with money, knowledge partners may come with knowledge, facilitators have the living and breathing space to do what they are great at. So Sahas is the right organization with its whole set of organizations to implement there. EdelGive, as a representative of the funder, is the right organization to speak to more funders and make that life easier for Sahas. And that's how I think if the principle of a collaborative is about pooling money, then it won't go that far. But if a principle of a collaborative is there are some principles, there are purpose, and the problem has to be attacked, then it's viable and it must be done. And to your point on why not give to one or two NGOs and why to a collaborative, I actually believe if people do not have risk appetite, if people do not have a vision, and if people do not want to really be part of many voices, it's okay, go and give it to one or two people. One or two organizations. I think this whole thing that everyone must collaborate or everyone must give singularly, that's not right. Do whatever you can, all right? But be part of this solution. This global issue that has come up, this global virus that has come up is actually a clarion call to all of us that whatever we can, we have to do. I would urge people that if you have, a larger vision, if you can trust other stakeholders, then you have to join collaboratives and allow stakeholders to do what they do. And that's why I think EdelGive is a complete, proponent of collaboratives. Our education collaborative for 5 years now has been a huge example of how things work. Government changed, bureaucrats changed, policies changed, but the collaborative is going strong with 1.5 million children because that's the way it works. And no way could have EdelGive done what a Gyan Prakash or a Kevalya has done. So to summarize, that is why a collaborative is very important. COVID is a much bigger problem than any one of us can do. Any one collaborative can also solve. It's about time that we address the issue of migrants post-COVID, but in a way that it brings them dignity in a way that they never got even before. I'll pause here.
Thanks, Naghma. I wanted to actually pass it over to Govind to pick up on some of the points that you raised around, everyone doing whatever they can to contribute, whether it's doing it through a collaborative, giving to one or two nonprofits. And Govind, you're an expert in retail giving, especially through your role in GiveIndia. And there's a lot of retail givers actually on this call as well. And so I wanted to ask you your perspective. What's the role of retail givers in supporting migrant workers going forward? What advice would you have for them?
So yeah, for me, I think the retail givers is the story for the future, at least from an India perspective. I think it's been discussed a lot about giving. And I just want to share a personal example. On March 21st, I launched my first ever personal fundraiser, and my goal was to raise $100,000 to support the migrant workers. And I reached out to my friends and family all through WhatsApp. And it's amazing that, within literally 10 days, I got $60,000, and within 20 days, I raised $200,000. And this is all the contributions came from far and wide, and many donors, I didn't even know them, but since my friends had shared this with their network, they contributed to this cause. And it just created a multiple effect. And in fact, it's this that led to the earlier COVID response fund that I talked about, that led me to say that let's put something together that make it a bigger collaborative, a bigger focus. So I'm a believer that we've just scratched the surface in India on retail giving, Swetha, at this point. And it's important that we recognize that the retail giver has the heart, wants to give, doesn't know how to give, doesn't know where to give. And they are concerned about, not many of them know of all the fantastic work that's done on the ground. And that's really the focus for us going forward, to make sure we get many retail givers to understand the great work that's happening on the ground.
Thanks, Govind. And I think that's one of the big roles that Indiaspora plays for the community. It really helps link individuals in the community to understand, well, where do I get what for? And I wanted to hand it back to Ashif for one quick comment, actually. One of the things that I think is really unique about the collaborative and also the focus of the effort overall is actually the focus on women migrant workers who are more vulnerable and have actually gotten less attention than some of the other migrant workers as well. And I know that could be a session of its own, but I did want to give a little bit of attention to that. What are some of the ways in which the collaborative is focusing on women in particular, Ashif? If you could just give a quick light into that, I think that would be really appreciated.
Sorry, my I think connectivity is not very good. So can you repeat?
Sure. I just asked if you wanted to share a couple of quick thoughts on how the resilience is, the collaborative is specifically focusing on women migrant workers.
Yeah. So basically, before the issues related to the women, I want to share one data with you. We are running a LMT system called Longitude Migration Tracking System in Bundelkhand to Delhi corridor. And basically, we identify that in the migrant population, the large percentage of the migrant come from the social excluded communities. So basically, SC/ST about 71%, and OBC community about 24%. So as Anshu mentioned, it's a forced migration. Like the people from the most excluded communities, they are not able to get like the financial opportunity at the source, so they are migrating to the urban area. So altogether 95%. About 21% women migrant workers are also there, and about 30% women also traveling with the male migrant worker at the destination. So, but in last like 5 to 6 months, if you see the pictures, if you see the media reports, if you see the government response, if you see any other response from the industry or any other like the authority, most of the people focus on the issues related to the male migrant worker. If you see the pictures, all male members are there, but nobody discuss about the issues related to the women migrant worker. In last year, only in Delhi NCR area, we documented about 112 rape and the gang rape cases of the migrant worker women. So basically the invisibility is very high and very important and crucial issue as far as the migrant worker is concerned. But within the migrant worker, if you see the exclusion and the discrimination with the women is also another very important issue. And currently no any like the government program or any other program are able to capture these issues and address these needs. So I think that's a very, very important and crucial need to respond in near future.
Thanks, Ashif, and I'm looking forward to seeing what the collaborative does to support women. It'll be fun to watch. I know that we're running short on time, so I wanted to end with one final question. You know, the work is only in many ways really just begun over the last 6 months, and what we've got in terms of kind of supporting migrant workers rebuild their lives, helping their transition, either staying in their villages or moving back to the cities, whether it's the city they were in before or a different city, is going to be a pretty massive undertaking, and one in which all of you have committed to supporting that journey. And so as you look forward to that large ambition, what's one thing that gives you hope and one thing that worries you? And this is open to each of you for a minute each, and then I'll wrap. Maybe I can start with Naghma.
What gives me hope is how, for once, I'm seeing not just generosity, but true intent of people who are having conversations with us about how they can, be a part of this solution, in what way they can help. The openness to, come together for such an audacious task is very high. And in my many years now, I've not seen this amount of real intent on the table. What worries me is we all have usually displayed a short attention span. And now that the migrants have gone away from our visuals, we are having enough to keep us entertained the entire day. Even COVID has stopped really scaring us. My big worry is that this attention should not wane. We have to remember the solution is not short term. It will take 3 to 5 years to even come to a point of reasonability on this. And so this is not about easy gratification. It is about walking the long walk and being there in those months where things look bleak and being there when things don't look good. And my worry is that I hope that this good intent sticks around for the many hard months that are there to come.
Thanks, Naghma. Govind?
So I want to re-emphasize what Naghma said. I think there's a lot more awareness of this issue. It's kind of died down a little bit now, but I think we need to resurface a lot more stories. We need to get people to recognize that the migrant issue has not gone away and it's a systemic issue which we need to solve. And what gives me hope is that I think people have demonstrated a lot more empathy and passion. I'm part of another institution called Social Venture Partners, and we've done about 7 leadership series discussions, and there's over 1,000 people have come for those sessions and are interested in learning more about what's happening on social impact across the country. And I think I think the awareness is very high. That gives me hope. How we as a group leverage that to help the causes is the next step. What gets me worried, or what I'm worried about, is what Anshu mentioned earlier, which is the focus has to be to make them sustainable in their homes. And not get them to be forced to leave their homes. And I think if we can achieve that objective over the next 5 to 8 years, I think we'll be really, really in good shape. But to make that happen, I'm not seeing as much collaboration yet demonstrating itself. I'm seeing the start of that, what Naghma talked about, what Ashif talked about, but I think we need a lot more of that.
Ashif?
Basically, I wanted to make 2 points. I completely agree with Naghma and like Govind. The same time, because every day I connected with many, like the migrant worker at the source and destination, and I realized the courage and the power in that community is very high. So they are facing multiple challenges and problems to their day-to-day life, but still the level of courage is very, very high in this community. And basically, I think that's very important. And because of their courage, we are able to think very like the large program. And basically the whole Migrant Resilience Collaborative is come on the basis of courage and power of the migrant community. So that's the one thing. The second thing, if you see in last 6 months, government announced 2 big programs. The funds were available, but no any system was exist. First is the BOCW. So the government of India basically announced that they can expend about 31,000 crore rupees under the BOCW and about 50,000 crore under the Pradhan Mantri Jan Rozgar Abhiyan, and one program for source and another program at destination. So I think these kind of program are exist, but the biggest problem is no any service delivery mechanism is exist. So if the civil society organization, private sector and other like the tech organization can come together, or startups can come together and develop some kind of solution, so definitely opportunities exist, just we need to go and basically convert the opportunity. So that's the second point. And the third point actually, as many people mentioned, in India, many times like if media highlights some issues, so like each and every organization interested to work on that subject. But after 3 years, fashion is changed. Many people discuss about the other issues. So then the people also shift to the other issue, including policymakers. So actually that's the biggest challenge, and we need to address how we can deal with these kind of challenges. Yeah.
Thanks, Ashif. And Anshu, last word to you.
So what makes me hopeful is obviously the way the citizens and the NGO sector really operated in this entire pandemic. I mean, the way, because the hunger is largely treated by the common citizen and the NGO sector. So that gives me a lot of hope for future also. The other hope is that people have gone back to the villages, a large number of them, and they belong to that place. And I'm just hopeful that if we really focus our attention on the villages, we can even solve the problem of the cities, because the forced migration will not happen that way. What makes me worried is maybe we are not the dignity part of people for sure, because now the migrant labor word has become so common that we are not even understanding that a large number of people who were software engineers, who were accountants, who were all kind of people, they were also forced to walk and go back to the villages that way. And the other thing is that how can I call someone a migrant worker? I myself basically, but I'm also a migrant, fine. Just that I am a very privileged one. I can stay in good houses and roam around in car, but I am also migrant. So how do we really come out of this entire demeaning kind of image which we have created for the migrant worker? The way we used to treat other people as beneficiaries, now we are replacing it with the migrant worker. And Swetha, you know what? Personally, I'm still looking for, when I got COVID way back in May end. So my last interaction happened with about 13 youngsters who waited for a few days to catch a train, and then they didn't get it. They started walking towards Sahas, Samastipur and Gorakhpur, Bihar and UP areas. And all that contact tracing ultimately traced to those people, because that was my last interaction. I often think, and very often think, and I'm doing an absolute useless effort to find those people, that I was contacted, I remained in isolation for 20 days, I was privileged to get the best possible treatment, I am back. What about those 13 people who, after contacting me, walked for days or maybe weeks and remained with so many people? What about their life? So at the end of the day, the so-called underprivileged remain underprivileged in this also. And the privileged one has recovered. So how do we really, just finish this divide somehow by using this virus as a chance? Thank you.
Thanks, Anshu. That last example, I think, really brings to the forefront just the inequalities that are exacerbated by the crisis. And I think you all did such a nice job of really helping to bring to life the issues that migrant workers are facing, the ambitions that you all have in terms of supporting them, and each of our individual roles in kind of working towards a better future. So thank you for taking the time to speak with us. And more importantly, thank you for all of the work that you do. The thing that gives me hope is the incredible work that you all are doing and the effort that you're making. So thanks again, and we'll catch you soon. Bye, everyone.